It is my pleasure to introduce Dr. Carlos Vera, who is the team lead for Cure TB Transnational Tuberculosis Referral and Continuity of TB Care Program at CDC, DGMH, SBHMB, and has over 15 years of experience preventing the spread of TB among populations that cross international borders. As a physician, he has provided care to several underserved communities, including the I'm going to ask him to share more about exactly where but including Mexico and and the Mayan and the Chiapas. He has worked with transnational TB program for 15 years with a primary focus in improving continuity of care for transborder TB patients and strengthening communication between established global TB programs in the United States. Dr. Vera, thank you so much for taking time to present to us. And I am seeing your slides in, yep, you're going to get it in presenter mode. Take it away.
Perfect. Thank you so much. Can you hear me?
Yes.
Yes. Okay. Well, first of all, thank you so much for the invitation to participate in this session during World TB Day. Today, I will be presenting an overview and analysis of the Cure TB program and its impact on supporting continuity of TB care for patients who relocate internationally. So I'll provide an overview of the Cure TB program, which it includes the referral process, a key MMWR findings. We just recently published an MMWR of the program. And this is going to help participants to use Cure TB to support continuity of care and improve the treatment outcomes for TB patients relocating internationally. My disclosure statement. And also, so where is Cure TB in the CDC? Well, Cure TB is part of the CDC branch called Southern Border Health and Migration Branch, which is the SBHMB that you mentioned. And that branch is a part of a division of Global Migration Health, the DGMH in the CDC. And in our branch, there are 6 programs in which Cure TB is one of them, and that's the one that we're going to focus today. Well, TB treatment, as we all know, is long, often lasting 6 months or more, especially for drug-resistant TB or other complicated cases, such as patients on second-line drugs or patients with drug absorption issues or drug allergies, etc. And interruptions in TB treatment, such as during relocation, can lead to ongoing transmission and higher risk of drug resistance. Patients who relocate internationally face barriers like language barrier, unfamiliar health systems, and limited resources, and that can disrupt continuity of care. Coordinating care across health systems can help prevent treatment interruptions for patients who relocate during TB treatment, and programs like Cure TB support this continuity of care. So a little bit of the Cure TB referral process. After receiving a referral request, Cure TB educates the patient on the process. So first, we review all the information that we receive for completeness, right? After that, we connect with the patient and provide education about the process. And very important to establish a rapport with patients. And then once we establish a rapport, we can obtain more and confirm their locating information at the destination country. And also, we make sure that the patient understands the importance of maintaining contact after arrival to support the continuity of care. And also an active involvement in their own care. That's a very important point for this referral process. So once the referral is ready, Cure TB coordinates with the National Tuberculosis Program. So every country has a National Tuberculosis Program that is part of their federal government that oversees most of or pretty much oversees the local TB programs. Also, we can connect with the national focal points if the national TB program is non-responsive, or we don't, or that's a country that we have never sent a referral, so we don't know the national TB program. We can reach out to the national focal points in those destination countries, and then we share this patient information, then confirm the patient arrival and enrollment into their TB programs, and ensure treatment continuation. After that, CureTV receives the follow-up information or these follow-up updates from the destination countries and we can share them with the originating jurisdiction. In this case, let's think about Washington State, any local originating jurisdiction there. And then we do it until treatment is completed, and that pretty much is going to help to ensure that the patients remain on treatment. And for those who return to the US, we make sure that they are not infectious upon arrival. So we recently published an MMWR highlighting the impact of coordinated cross-border care in helping TB patients continue treatment during relocation, showing that most patients successfully complete treatment, especially when care is linked quickly after departure. For this slide, we can see this is all the type of referrals that we handle, which is with confirmed TB, suspected TB, contact notifications, source case investigation, and clinical history request. The vast majority, as you can see, for the 56% is the suspected TB, because also Cure TB works with patients on detention facilities that are going to be repatriated. So that's what you can see, the vast majority of the suspected TB. But 35% that we receive are confirmed TB, and then the smaller percentages for contact notifications, clinical history requests, and source case investigations. And now, focusing a little bit more in the referrals that we received, the requests for referrals, California, Texas, Arizona, New York, and Washington were the top 5 referring jurisdictions to Cure TB in those years between 2016 to 2023. And Washington State was the 5th highest referring jurisdiction, highlighting its important role in utilizing Cure TB to support continuity of care for patients relocating internationally. And now focusing on this 35%, which is the confirmed TB. For those 35%, we only made referrals for 72%. And the reason for that is the 22% did not require referral. And the reason for that is if some of them, they are within 30 days of treatment completion and they are leaving, they are relocating to another country, Cure TB does not send a formal referral. The reason for that is because sometimes it takes about that time to connect the patients. So we normally just recommend to the referring entity to provide the medication to the patient to go. There are so many, sometimes the health departments don't trust the patient that the patient is going to take the treatment or is not going to take the treatment correctly. So we also recommend if they can do a video DOT for the remaining 30 days. And also those in this 22%, there were patients that did not relocate. That means that the referral was received. So we received the referral, but then the patient ended up staying in the US or another country. And then 6% of them, the referral could not be completed because there was insufficient contact information. And for those ones, you may sometimes if you send a referral to Cure TB and there is no and there is insufficient contact information or how we call it insufficient locating information, that means that we cannot connect with the patient either by telephone number or any contact person, or either we send we cannot even verify the address. Then you are going to receive an email from Cure TB that pretty much that is that the referral request when they are sent to Cure TV after the patient has departed without the patient locating information in the destination country. Cure TV is unable to complete the referral process, and this process includes providing education to the patient about the referral process and what to expect regarding the continued care, also providing education about TB and obtaining or confirming the patient locating information in their destination country. In such cases, Cure TV can only send a courtesy international referral to the National TB Program for awareness. And then after sending a notification in accordance with our Cure TV protocol, we are going to close the case with no subsequent follow-up to the referring jurisdiction. However, if the NTP, the National TB Program in the destination country, locates the patient, Cure TV will promptly notify the referring jurisdiction so as to proceed with the standard referral process. For those ones, we recommend that the local health department connects with their CDC Port Health Station in the jurisdiction to learn about federal public health tools appropriate for the case on the review, such as restrictions for travel or contact investigations. The Cure TV MWR showed that most patients successfully completed treatment, which was 79%, with higher completion rates when care was linked quickly after relocation, demonstrating the effectiveness of coordinated cross-border care. Uh, so talking about that, one key finding was that shorter intervals between departure and reestablishing care were associated with higher treatment completion, underscoring the importance of rapid linkage to care after relocation. If you see when patients were connected in the first 30 days after relocating, the completion rate was 91%, which is very close to the national goal. Also, this MMWR highlighted that Mexico was the most common destination for Cure TV referrals, with 34.4%, underscoring the importance of a strong cross-border collaboration between the US and Mexico. Also, other countries as Guatemala, Honduras, India, the US, Peru, Colombia, Ecuador, Venezuela, and El Salvador were the following ones. What Cure TV is doing now, I'm just combining between findings from the MWR and procedures that we are doing. CureTV has been doing these international agreements for referrals with different countries. We already started with India and Vietnam when CureTV did a visit in 2024, and also we did it with Mexico, and we are going to continue doing with different countries to establish more agreements for referrals with the countries that where we refer the most. A key limitation was that for 26% of patients, only the final treatment outcome was available without detailed information on how quickly they were linked to care after relocation. And another limitation was that for some patients, no follow-up information was received for the patient or destination providers, making it unclear whether they continue and complete the treatment or were lost to follow-up. As a result, we just ended up classifying those cases as lost to follow-up. Early referral and complete clinical information can improve treatment completion, and the QTB model demonstrates how coordinated cross-border care can strengthen the TB control efforts globally. Our recommendations for referring providers, which are the local and the state public health department, is to refer the patients to Cure TB when they are planning to leave, ideally, or have already left, before completing treatment, and to include key clinical detail, treatment regimen, labs, at least two reliable patient contacts that know always where to find the patient, locating information to support continuity of care. Remember, when we send a referral to another country, they need the proof of the TB diagnosis. Most countries, they don't treat clinical TB the way that we do it here in the US. And for us, we need always the most comprehensive clinical information. If a patient is pan susceptible, but the patient is on a second line drug regimen for a different circumstances, we need to know exactly why, because that's information that we have to pass to the next country. Because if they don't have the same medications available, they already understand the reasons why we're using different regimens, or the same. Sometimes we receive referrals for patients that are receiving very high doses of rifampin or INH or some other medication because of low absorption problems, right? That is such a thing is very complicated to understand in other countries. They don't do it that way. So then when they see patients that are on 900 milligrams of rifampin, or they definitely are not going to treat it. But if we explain and we show them the proof that this is what happened and that's what this patient needs, this type of this dosaging, then they understand that they can help us and help the patient. Um, this is one of them. Also, there are patients that they develop an allergy to some of the medications, and then it's second line drugs. Well, we need to have that evidence so then we can pass that to the ongoing country. And okay, so then this is the regular process for referring to cure TB. As many of you know, you find the form, the CureTV form, in our website, and then you fill it with all this information, which is the referring jurisdiction, the type of referral that you are requesting, and also the some demographics of the patient, locating information in the US and in the destination country, and also some summary of the clinical information, which is the smears, cultures, drug susceptibility, if the patient has some comorbidity, the treatment regimen, and some story. And then after that, you receive an acknowledgement letter that we received that referral. But the reason that I'm mentioning this now is because we are now implementing a new system. It's not yet out, but we are doing it. We are developing a database application that we're already using since 2023 in CureTV, but we are going to give access to the referring jurisdictions in the US as external users. So that means that they are going to be able to enter their own referrals. Pretty much the same information that you see here, that's information that is going to be entered directly into the database application. So that's going to have a lot of advantages. The first is that the CureTV referral manager doesn't need to transfer the same information into the database. So pretty much the information that you already started is going to be in the database already. And then also you're going to be able to see updates in real time. So you're not going to be requesting like every periodically to see what happened with your patient. You are just going to log in and see what's the outcome or the status of your patient. And obviously that's going to have some degree of access for external users versus for the CureTV program. Our plan is that by 2027, all the US states that refer to CureTV are going to be entering their referrals directly into the application. And this is just the reference for the MWR. And thank you very much. I'm open for questions. Thank you.